Hello everyone, and welcome to Counselor Ear Feature Friday. I'm your host, Brian Urban. In these features, I hope to give you some simple tips, tidbits, and tricks to make your days easier and your patients happier. In this feature, we're going to talk about the TAS subscription for patient annual hearing aid follow-up. Now, this is a TAS subscription that will automatically create a to-do task 30 days prior to the anniversary of the patient's hearing aid fitting date. Okay, so this is the way, once again, that you can follow up with a patient annually based on their fitting date. So if you wish to enable this, of course, go ahead and check that box. And then you'll have a few options here that are fairly standard with the rest of the task subscriptions, meaning you can decide whether you want this task assigned to you, to the user who's currently signed in, or if you want these tasks assigned to the clinic. And this would be more of a general pool where anyone in the clinic can work on that task and complete it, of course. There's also the ability to restrict based on future appointments. So you can decide, do we want these tasks created if this patient already has an appointment scheduled or not? That's totally up to you. And then you can decide if this applies to all the clinics in your organization or a subset of clinics. Okay. So those are fairly standard features in other subscriptions, but some unique tools here. First off, the ability to select which providers you want these tasks created for. And let me specify that further. This is primarily used if you want these tasks. Okay, so I fit a patient last year. I want the task created for me to follow up with that patient, right? So I'd go ahead and sign in, pick myself as the provider, and then make sure that user task is selected. This will create tasks for me when my patients come up for an annual review based on their hearing aid fitting date. Okay, or once again, if you want it to be all providers, go ahead and select that option as well. Okay, you can also pick whether you want these tasks created when it's just primary devices or secondary devices or all, right? So you could probably most commonly set this to all or primary. There also could be a scenario where maybe certain people handle the follow-ups for primary devices and someone else handles the follow-up tasks for secondary devices or something like that, right? You might have a system internally as to when you want to distribute those tasks, okay? And this is probably the most unique feature here, and that is the number of recurrences. So this basically says, okay, a task can be created annually, once again, based on the fitting date, but it can continue, you can do it multiple times, right? Not just a one year thing. So you can actually go up to 6 years. So if you want a task made every year based on these devices' original fit date, you can do so. It also means that if you fire up this task subscription, let's say you have some devices, you fit 2 years ago and 3 years ago and 4 years ago, it will still create the annual review for the next review date, right? So those 4-year-old and 3-month devices, when it's approaching, 30 days prior to 5 years, it will create the task, right? Depending on which option you select here. So basically, what that means is this feature is essentially retroactive, right? You don't have to start this. Won't only just work for newly fit devices. It'll work for all the devices in your patient database, right? So something to keep in mind as you set these different options here. And then of course there's options for filtering by patient tag, device tag, and then very importantly you put your task subscription in, right? So this is just a very basic one we have entered here. It can be much more elaborate if you wish. Certainly using placeholders can be a great way of making that task very clear, very specific, without having to do the work to make it that specific. Now, when you activate this and you put your settings in, your preferences, it's very important to hit save at the bottom of the screen. That will lock in that selection, okay? From there, it just starts working. So every night, then Counselor will look at your database and start looking out and say, are there any fitting dates coming up in the next 30 days? And if so, it'll create a task for that patient. If you have any questions about this, please give us a call, email us, live chat us. We are always happy to help. Thank you very much for joining us for today's Counselor Ear Feature Friday. And as always, have a wonderful, wonderful weekend.